The role of occupational therapy is evolving fast. 2025 is bringing major shifts in the way our health insurance works, aging in place, gig work, and policy. And OTs need to understand and be the center of it all. Thankfully, more businesses and families and older adults are focusing on proactive aging, making adjustments earlier so they can maintain their independence longer. And at the same time, the gig economy is exploding. This offers new ways for people to work independent of larger institutions. So how do we as OTs stay ahead of the curve and use these trends to grow our careers and impact more lives? In this video, we're diving into the shift to proactive aging and how that impacts OTs, how the gig economy is helping to open doors for OT pros, why OTs are stepping into advocacy and policy like never before, and the latest tech that's shaping aging in place. So let's dig into it. Hey, I'm Dr. Brandy Archie, occupational therapist and founder at AskSAMIE, where we provide answers for caregiving. Let's start by talking about this shift to proactive aging. You might have been calling it aging in place, but really what the trend is that older adults are more aware of their desire to stay living at home and trying to be proactive about making the changes they need now so they can make that happen. Aging is no longer reactive, and it probably never should have been. Families and seniors are planning even earlier now for aging in place, and so this proactive approach really needs OTs to be in the center of it. Thankfully, all of our advocacy has been helpful, and families and older adults are really thinking about what they need to do in order to make sure they can stay living in their homes. And so while they're ready for that, they really still need the expert guidance of an occupational therapist to make sure they're thinking through all the scenarios and all the ways that they can prevent those in really cost-effective ways. And this is what OTs are great at. So this means while you might do home assessments to help somebody discharge from a skilled nursing facility, you might also be able to provide some preventative home assessments and wellness coaching for people who are trying to prevent that admission to a rehab hospital. There's also a growing demand for virtual occupational therapy consultations. These can be done on home design, on accessibility, and on adaptive technology, and plenty of other things I'm not thinking about. The OT Compact is coming into effect soon, and that's going to make virtual OT an even easier thing to accomplish. In addition, Medicare and private insurance are slowly coming around to the idea that prevention is a better way to protect people's health and also protect their bottom line. So pair this new set of needs to the desire for the gig economy to continue to grow. There's always lots of ways that people work in the gig economy, whether that's driving for Uber or picking up for DoorDash. You too should be able to use your skills in a way that makes sense on your own time frame and make it easy to connect with the people who need you right away. Now, traditionally, we've worked in hospital settings and clinics and home health and private practice even, but that's changing and opening up to some different ways to think about how we use our skills. Gig work gives you the ability to use your skills to generate income, but also be in control of your schedule and how much time you're spending doing it, and also how much you charge. Most importantly, I think gig work gives you the opportunity to provide services in the way that you actually want to, not necessarily the way that the medical model is forcing us to provide treatment. So as more families are seeking occupational therapy-led assessments and modifications and different tools, that also means that more OTs are able to go into business to meet that need. So if you want to take advantage of this shift as the trend is getting started, I think you need 3 key things: a way to connect and meet with new clients, a community to share resources and tools, and access to business building opportunities. So this is where OT Connected by AskSAMIE comes in. Since we've been seeing this trend happen, we wanted to be able to provide those 3 areas of support for OTs so that we can leverage all of us in the country in a way that brings us to the forefront. So that's a lot easier for families to find an OT in their own community and have their needs be met. Whether you're looking for part-time work, flexible consulting gigs, or full-time business opportunities, OT Connected's goal is to connect you directly with people who need your services while supporting you with the tools you need to grow. It can feel super daunting to take on marketing and finding a billing software and how do I start an LLC and what if I just want to do a few visits on the side. That's a lot of things to consider, and we're putting all the tools in one place to make that a lot easier for you to do. Check out OT Connected in the description below if you're looking to take advantage of the gig economy and grow your OT career on your terms. Third is OTs and policy and advocacy. OTs are influencing Medicare and Medicaid policies to expand funding for proactive home modifications. Some Medicare Advantage plans and many of our Medicaid waivers already provide this funding, and it's really important that we continue to expand that and also protect the funding that already exists despite the current political climate and all the cuts that are occurring at the moment. We generate a ton of value. And so OTs advocating for ourselves as clinicians, but more importantly, for our patients who benefit from our service is really important. It's also more important than ever for us to pay attention to legislation about accessibility. OTs are also helping to shape the laws around universal design, which is a forward-thinking concept about the ways that we might build our infrastructure to be accessible to as many people as possible. But in the current time, we also need to make sure that accessibility remains protected despite the current demolition of diversity, equity, and inclusion policy. So to get involved, follow the updates from AOTA's advocacy team as they are constantly working on policy changes that affect our field. And they're often sending out updates to have us reach out to our state and local legislators to make sure our voices are being heard as to why these things are so important. So let's talk about tech and the future of aging in place. 2025 is already seeing a huge boom in age tech and digital health services to help with aging in place. It's really important that OTs stay familiar with these tools so you can be sharing them with the right patients who could benefit from them the most. There's a lot happening with smart home adaptations. It's becoming easier than ever to use voice-activated controls, to have fall deterrent and fall alert systems that are remote, and having AI-powered reminders. The world is endless in this capacity, especially if your clients are open to applying a little bit of technology. Wearable health tech is also really on the rise. So we started out with Fitbits and Apple Watches, but now you have a ton of wearables that can do everything from EKGs to checking our oxygen saturation and alerting someone if a fall happens automatically. Telehealth and remote monitoring are also really important advancements. Telehealth for occupational therapy is a great way to expand our services so long as it continues to be reimbursable under Medicare, so make sure you're advocating for that. And remote patient monitoring is also really important and an underutilized service. It's billable to insurance, and it gives you the opportunity to be able to communicate with your patients in between sessions and continue to influence their recovery. So how can you as an OT stay ahead? You might consider getting a certification in aging in place, and there are quite a few kinds. That way you can be as up to date as possible and share your credentials with others so they know you're an expert. You could also consider exploring some of the telehealth platforms that exist in order to expand your services and maybe create a program in the place that you currently work. And you should definitely sign up for our weekly newsletter so you can stay up to date on the latest technology that exists for making aging in place easier. So what I really want you to take away from this video is that the future of occupational therapy is expanding. 2025 is opening up so many new doors, whether it's because of proactive aging or the growing gig economy or recent tech advancements. It's the OTs who embrace these trends who will have more career flexibility, more impact, and more opportunities than ever before. So if you're interested in exploring independent work, please do check out OT Connected. The link will be in the description of this video. And if you found this information valuable and useful, please like and subscribe and share it with another OT so they can stay up on what's going on too. Let's shape the future of OT together. I'll see you soon.